Good afternoon, and I want to say thank you to everyone for being here today. Joining me today are the presidents of Arizona's 3 state universities, and I want to say a special thank you to another leader who was unable to join us today, Chair of the Arizona Board of Regents, Larry Penley. I'm very grateful for Regent Penley's dedication and leadership on the Board of Regents, especially during the COVID-19 crisis. First, I want to provide everybody a quick update on where Arizona stands on COVID-19, and I want to begin by saying 2 words. Thank you very much for your commitment and partnership. Arizonans have really stepped up in the last several weeks to slow the spread of this virus. Percent positivity was 20% at the end of June. Last week it was 4%. Percent of patients with COVID-like illness was 21% in June. Now it's 2.3%, and that's a decline of 10 consecutive weeks. In addition, the number of hospital beds in use by patients with COVID-19 is at its lowest point since April. And this week, the number of ICU beds in use for COVID-19 patients hit its lowest point since we began reporting the data. And last, but certainly not least, our university students are beginning to get back into the classroom. This is all very good news. And again, I want to thank everyone for their vigilance and sacrifice. And I want to emphasize that Arizona needs to keep these efforts going. Now, I want to talk a little bit about our universities, and I want to say that Arizona's progress to combat the coronavirus would not be possible without the partnerships we've forged along the way, with possibly none being more important than those with our universities. Our universities have adapted to keep students engaged and learning. They've brought about innovations to COVID-19 in testing and in tracing. They are manufacturing PPE in revolutionary ways, and they are even testing wastewater to monitor for COVID-19 so we can stop an outbreak before it starts. In short, Arizona's universities are proving once again why they are some of the finest in the world. To date, the state of Arizona has provided millions of dollars to help keep everyone at our university safe and to boost innovation to fight COVID-19. And today I'm proud to announce that Arizona is doubling down on these investments in a big way with $14 million new dollars. Our latest investments include $8 million for additional testing, surveillance, and other response efforts at all 3 universities. On top of that, Arizona will be investing $6 million into ASU's development of groundbreaking testing known as point-of-need testing. With point-of-need testing, Arizona's first responders, healthcare workers, people in congregate care settings, and others will be able to get tested and receive their results not in days or hours, but in minutes. These investments are critical for helping our community stay safe and healthy. Now, before we get to our next speaker, I'd like to quickly touch on some of the great work being done at each university. And let's start with Arizona State University. Among many achievements, ASU has developed and deployed one of the first saliva-based tests in the United States. They have also designed and deployed an online network of 3D printers to produce PPE for healthcare providers and hospitals around the state. And Dr. Crow, as I just mentioned, ASU's point-of-need testing will be a game changer for frontline workers. We can't wait to see it come to life in the near future. Next, we have the team of the University of Arizona, led by Dr. Bobby Robbins. The University of Arizona has distinguished itself as a national leader by developing one of the most accurate antibody tests in the country. You could even call this test the gold standard. Our state has equipped the Wildcats with $3.5 million to provide 250,000 antibody tests to Arizonans, and they're well on their way. On top of that, the Wildcats have provided, on their own dime, more than 17,000 PCR test kits to communities that need them most. This includes 7,000 tests for Arizona's tribal nations. Dr. Robbins, your institution is aiding response efforts not just in Tucson or the state of Arizona, but throughout the country, and we appreciate your hard work through the crisis. Then, of course, we have NAU leading the charge against COVID-19 in Coconino County and beyond. NAU's Center for Health Equity Research has been embedded into the Coconino County monitoring team, helping to investigate and contact trace COVID-19 cases since the beginning of the pandemic. In addition, NAU's Regents Professor, Dr. Keim, is leading the Arizona COVID-19 Genomics Union, or ACGU. Arizona's 3 universities and TGen to sequence, analyze, and track different strains of COVID-19. Lastly, NAU's Information Technology Services team has installed drive-up Wi-Fi. These services are available across the state, helping families stay connected. Dr. Chang, you and your team have prioritized the health and well-being of our entire state, and I'm grateful. And with that, I'd like to turn it over to our next speaker and congratulate him in advance for the recognition of Arizona State University for the 6th year running being declared the most innovative university in the nation, and he has certainly brought that spirit of innovation to the COVID-19 crisis. Dr. Michael Crow.
Thank you, Governor. I'll do 3 things in this brief set of comments. First, ASU is up and fully operational. We have over 2,000 research groups, 10% of which are focused on COVID-related things, working, driving forward, working on solutions, developing new science, new technology, new solutions. We have 74,500 students engaged with us in hybrid modality. That is, some classes are in person, some classes are hybrid, some classes are online, and another 50,000 students that are attending online only for the largest enrollment that we've ever had. We have about 20,000 students, give or take, on campus, 15,000, 20,000 any given day. We're operating in a modality where students can come in, anyone can come in now in the sync mode to any of 1,000 classrooms that we have. So all in all, the university is operating both from a teaching, learning, and discovery perspective, and we're very happy about that. Relative to the management of COVID, we had the first reported case in Arizona back in January, the 3rd reported case in the United States back in January. We've been managing COVID since then, and we knew then and know now it's a long-term thing. This is a permanent introduction of a new virus to the human ecosystem, and we're going to have to be managing it for a long time, and we've taken that approach. We've taken that approach so much so that we realize that we have to deal with positives in the student body, positives in our residence halls, positives on our staff. We're down about 80% from where we were a few weeks ago in terms of positives, and so we're very excited about the fact that the techniques that we're using, the social isolation, the testing, the masking in particular has been powerful. We have no reported transmissions from students to staff. In fact, we'll announce in our data tonight that we have 1 positive employee at the university. The largest number of positive employees we had was before students returned, when the virus was running around a lot more actively back in July. Lastly, I'll talk about the point of need test. ASU's been working since 2003 through our Biodesign Institute as a frontline, unbelievable, state-of-the-art, best humans can deliver scientific organization, and it turns out that the scientists that we put together there have a unique capability of working together, engineers and computer scientists and biologists and physicians and virologists and everybody else that you can imagine. And so for the last more than 10 years, we've been building ways to defend against biological threats. We've been funded by the Defense Threat Reduction Agency, the Defense Advanced Projects Agency, the BARDA, the agency defending against biological threats, either man-made or natural, that come. And as a result of that, the point of need test that the governor mentioned is something that we believe that we can have a prototype ready in 6 months. You'll spit into one of the most advanced technological devices that you could possibly imagine. On the device is a series of microchip chips and small laboratory devices that take objects smaller than a than basically just a couple of molecules, move them around, heat them, do the chemistry evaluation in a thing not much bigger than an electrical thermometer. That then communicates with your cell phone. You get the green light, you go to school, you go to work, you go to the game. This is a powerful, powerful thing, drawing from 100 people that we've had working on this and projects that we've been working on, and so we're very excited that we've been asked to now develop this point of need test. All of that is going on. ASU, it's funny, sometimes we hear people talking about the university being opened or closed. We're never closed. This is a 24-hour-a-day, 7-day-a-week operation, always open, always moving forward, always finding ways to be of greater service in teaching, learning, and discovery. So thank you, Governor, for the opportunity to advance this project, and to our colleagues for being able to work together. I think all of us among the universities are of the view that our mission, we're an essential industry, we've been designated an essential industry, is to keep things moving, and that's what we're doing.
Good afternoon. Thank you, Governor, for inviting us all here today. I'd like to start out by saying how proud I am of the Wildcat Nation for our students, our faculty, and our staff, and our expert teams that have put together one of the most comprehensive testing programs in the country. Their efforts were recently recognized by Dr. Deborah Birx last Friday when she was at our universities, that she's been visiting around the country and went back and reported back in Washington about the incredible protocols that are being done at our universities here in Arizona. The U of A's Test All, Test Smart program utilizes all three COVID tests: antigen testing, PCR testing, and antibody testing. All of these tests are run in-house at the University of Arizona by our scientists and physicians, and we're ensuring rapid turnaround times. Our tests are not just random surveillance tests only, although we are doing that. We test all of those who've been exposed, who've been contact traced, or detected through wastewater-based epidemiology. 94% of our tests are rapid response. That's within an hour, and this is our antigen test that we're deploying for asymptomatic individuals. All symptomatic individuals receive a PCR test. We have supplies currently from our partner, Quidel, for 8,000 antigen tests per week, and the capacity to do 1,700 PCR tests a week at the University of Arizona. For the past 3 weeks, we've run at least 6,000 tests a week, and we're on pace to do about the same this week. Over that same period of time, our positivity rate has hovered around 10%. We tested all the students who came back into our dorms. They were all negative, and within a few weeks, we of course saw a surge. Recently, our current positivity rate is around 4%. On Tuesday was 4.3%, and yesterday 3.9%. The latest data available on our dashboard that Dr. Birx reviewed last week is said to, she put a new standard to reporting. And you can visit that dashboard at covid19.arizona.edu/dashboard. Our program is augmented by wastewater-based epidemiology. Dr. Ian Pepper is leading that effort at the University of Arizona and is being used in our dorms and our Panhellenic housing and now in off-campus housing. Certainly this is a way to find asymptomatic carriers that are shedding the virus in wastewater before anyone has a symptom. When we find a hot spot in a dorm, we go in and test all those students, find the asymptomatic positives, and then isolate them out of the general population. I'm also incredibly appreciative of the partnership we have with Mayor Romero, the City Council in Tucson, with Chuck Huckleberry and the Board of Supervisors of Pima County, and particularly the Pima County Health Department. Over the last few weeks, the county has set up over 30 pop-up testing sites at off-campus housing location, including the sky rises and our Panhellenic homes. Students who test positive isolate to keep from spreading the virus further. Both on-campus and off-campus students are in our isolation dorms. Currently, we have 372 students in isolation dorms. 77 students from the dorms are isolating off campus. 250 beds continue to be available, and we have surge capacity with local hotels. Today, 34 students are returning to regular dorms from isolation, and we've seen up to 100 being discharged from our isolation facilities. I would also, in closing, like to take time to remind everyone that our antibody test is now available to all Arizonans over the age of 18. This is being offered through our partnership with Dr. Christ and the governor in the state of Arizona. To sign up, please go to COVID-19 antibodytesting.arizona.edu. Thank you.
Good afternoon. It's a pleasure to join Governor Ducey and my fellow university presidents to share highlights of NAU's comprehensive efforts surrounding discovery, research, mitigation, prevention, and treatment of COVID-19. Since the start of the pandemic, NAU has harnessed the resources of our powerhouse NAU faculty, researchers, and surrounding academic and research institutions to learn about the virus and find ways to mitigate infection, and in an effort to keep our communities safe. In cooperation with the state of Arizona and Coconino County officials, NAU implemented a robust plan to manage the spread of the virus, including prevention, testing, tracing, and isolating. Specific efforts included requiring every student who lived on campus to provide a negative test result upon move-in, and phasing in-person instruction to the current hybrid model. An expanded testing program for our NAU and Flagstaff communities, including mandatory weekly mitigation testing for over 2,000 students, faculty, and staff, and approximately 1,000 tests per week to the Flagstaff community. Our aggressive mitigation testing effort in particular has allowed us to identify cases of asymptomatic individuals throughout the region that would have otherwise gone undetected. Last week, the Arizona COVID Genomics Union, ACGU, that has been mentioned by Governor Ducey, and is led by Regents Professor Dr. Paul Keim, published findings of a study tracking strains of COVID-19. This collaboration between NAU, TGen, ASU, and University of Arizona suggests early efforts helped to contain the spread of COVID-19 after the first known case in January at ASU. TGen and NAU sequenced genomes from almost 3,000 COVID-19 positive samples for ACGU, with additional sequencing performed by ASU and University of Arizona from among more than 200,000 positive cases in Arizona. Working with Arizona public health officials, ACGU scientists applied the results toward statewide efforts to track, test, and track patients and provide guidance for state public policymakers. Since the start of the pandemic, NAU staff have supported county epidemiologists and public health teams in Coconino County working to track the spread of COVID-19. Work has focused on investigation and data management, contacting exposed individuals to discuss quarantining, and analyzing the burden county health systems could expect. Other initiatives include testing of wastewater, providing nursing care through telehealth, supplying personal protective equipment, and installing Wi-Fi across tribal lands in rural Arizona to ensure students could continue their education remotely. These are just some of the highlights of our widespread efforts. We're grateful for the opportunity to share these with you. Thank you, Governor.
Thanks so much, Dr. Chang. I really appreciate it. I want to say thank you as well to Dr. Crow and Bobby Robbins. These universities have very much been our secret weapon here in Arizona. We are blessed with 3 amazing leaders, and they have incredible teams. And let me just say, there's no one Arizona would rather have collaborating, innovating, and working to keep everyone safe as we battle COVID-19 than these three people that are with me today and their teams. Along with that, I am joined by Dr. Kara Christ, who leads the Arizona Department of Health Services, and Major General Mick McGuire, who leads the National Guard and our DEMA efforts. And with that, we'll take some questions. Patrick?
So my question is for Dr. Crow or Dr. Robbins. Are schools coming back to the Pac-12?
Is it 4 o'clock yet? Listen carefully at 4 o'clock.
All right, well, fair enough. All right, so my follow-up, you don't want to tip your hand, that's fine. For Dr. Robbins, specifically for you, I've seen you quoted saying it's not worth it, your experience as a cardiologist and the prevalence of myocarditis for athletes that might get COVID. Has your position changed on that?
Yeah, it has. I think we've had.
You only exist if you're not on the microphone.
I got it. Yeah, I have modified my position on that early on.
By the way, you're a famous heart surgeon also.
I used to play one on TV, but I'm not anymore. Yeah, after looking at the data, and I think the early reports we saw coming out of some of the teams back east that there have been national panels of cardiologists that have reviewed the data. I didn't personally get to review the data, but I was concerned for sure. And I think Michael and our colleagues at the Pac-12 were very concerned about having the adequate testing and learning more about these data. And so I think that after looking at that and watching the protocols that are being put in place by the NBA, the NFL, and the other conferences, I'm comforted by the fact that we can safely take care of our student athletes.
You'll vote for a return. Will you vote for a return today?
Well, I think that, as Michael said, 4 o'clock.
We'll go to Dennis next. We gotta keep moving, please. Dennis next.
Sorry. Good question for the governor. I just wanted to follow up and move this back to the student advocate Secretary of State's office. And I just wanted to ask you to get your thoughts on this. It's these voters that are in long-term care facilities. These facilities aren't allowing anybody in. If they don't have any caretakers, then someone from the election board couldn't go in there. Are you okay then with them not voting, disenfranchising them?
Listen, I want everyone to vote. I want every eligible voter to vote. I want everyone in a long-term care facility to vote. And we're going to find a safe way for these election boards. This is already set to be inside these long-term care facilities so that they can vote. No one's going to be disenfranchised.
So what's the plan?
The plan is that this is part of the investment that we've had ongoing with the Secretary of State's office so that we have a successful election cycle where no one's disenfranchised, whether you vote by mail, whether you use and work with one of these election boards inside our long-term care facilities, or whether you vote on Election Day.
All right, and I did want to follow up too. Several months ago, you were asked when we started having some of these press conferences, when race relations were getting heated, you were asked at the time about systemic racism and racism itself, and you said, quote, "I'm still learning on that." In several months now, given what's going on in the country right now, what have you learned in that period of time about systemic racism? To be specific about that.
Well, first, I don't think you have my quote correct. I said that racism exists. And then I addressed what we're doing in Arizona, the deliverables that came out of our meeting. And since that meeting with African American and minority community leaders, there have been a dozen meetings to follow. Of course, it was top of our agenda to have body cameras for all officers in the Department of Public Safety, and that remains a priority. That would have happened, save COVID-19. We wanted to, of course, diversify the post board and make sure that it was more reflective of the community, and those efforts are underway. And a direct ask of the community was that we would pay more attention to the vulnerable in their community during the pandemic, and we delivered with surge testing to Maryvale and South Phoenix, and those efforts will be ongoing.
We'll go to Nicole from Valdez.
there are a lot of people right now, we are very close to starting voting for Arizonans here. I know we've already started overseas. And a lot of people have a lot of questions about our elections. And so my question to you is, will you be able to assure voters that if the Democratic candidate, Joe Biden, does win the presidential election this year, that those results will be relayed to Arizona electors and they will cast that vote as the electoral college?
So I want to say that election integrity is top of mind and top priority for me in the state of Arizona. And you're right, November 3rd is 40 days from today. I think we're 13 days from the permanent early ballot, permanent early voter list ballots being inside your mailbox. And I encourage all Arizonans to vote, and we will tabulate the vote. I do want to manage expectations that we likely will not be declaring a winner, possibly at the state level, certainly nationally, on the evening of November 3rd, and whoever wins that electoral college will be declared President of the United States.
And follow up to that quickly, you know, you obviously have gone to several events with President Trump in recent months for several different reasons. You know, he made a comment yesterday that had some people asking some questions about whether he will leave the White House peacefully. Would you say that you would try to encourage the president to do so if he does lose this election?
Well, what I would say to you is we've been doing this as a country since 1796 with a peaceful transition of power. And I think that those comments were clarified today in terms of that there would be respect for any free and fair election. And I think that's every American's expectation.
You know, how even in the Doctor, actually, you've been hiding in the background, so I think it was time for you to come out from the shadows. I become not an expert certainly on your dashboards and benchmarks, but quite a follower. We have a situation in at least several counties where the trends in the infection rate are going up, where the trends in positivity are going up. I realize you need 2 weeks to have a trend. If we get to a point where any of these counties go 2 weeks of suspension, will you reclose those businesses because we're back where we were in June?
So we're working with our county health departments to, as we're looking at the data, we are seeing that there are counties that will likely go back into substantial spread starting next week. So we're starting to work with those county health departments to identify if there are targeted areas where we can work specifically with those business owners. We want to avoid closing down. If we can implement mitigation strategies, that would be preferable. So we are working on that as it comes forward.
Let me take that, Doctor. Okay. Arizona's open. Arizona's economy is open. Arizona's educational institutions are open. Arizona's tourism institutions are open. The expectation is they are going to remain open. We are not going to be, due to a gradual rise in cases, be making any dramatic changes. We should expect a rise in cases. You just heard about the amazing technology and rapid results that we're going to have from saliva-based tests and on-site-based tests. So you should expect that. What you should look at is our positivity rate, our hospital capacity, our ICU capacity, which are all at all-time lows, low being the positive number that we want. So there's things that we can do, just like we have been doing, socially distancing, wearing masks, washing hands. But Arizona's open, and we're going to remain open in a safe and healthy way.
So just to be clear, you're seeing no circumstance under which
I'm talking about where we are today. We're open.
My question is actually for Governor and for Dr. We've had a number of families who have lost loved ones to COVID-19 over the past few months, many in our site that we saw, alleging inequities in our hospital care. We know some hospitals had greater staffing shortages, others were offering fewer treatments or had different guidelines for treatment distribution. We've tried to answer this question for them through data, but ADHS and individual hospitals across the state have refused to provide us with hospital-specific data. Through this lack of transparency, families want to know if we are prioritizing profits over patients. And my question is
So I would probably have to follow up with you after this to identify which specific data that you're looking for.
We've asked for the number of COVID-19 patients admitted to each hospital, the number that have walked out, and the number that have died.
So let me go back and check. That is, the hospitals report the numbers of patients, but we don't have every patient in our database that has been hospitalized.
And you have the
So,
number of deaths.
not that have died in the hospital. So they will report an aggregate number, and so it's an aggregate, not specific number.
Because hospitals have told us that specific data is in your hands and is all directed us to your clinic.
So we would have to go back. It is that self-reported aggregate data, but we can take a look. We cannot break it down by potential hospital, but that's something that we can look at how we can get you that data. So if it's potentially identifying, somewhere in Maricopa County may not be potentially identifying if it was just one facility. But when you get out to rural counties, you probably could identify if there was an individual death or an individual patient that had a specific case or knew on a date that you could identify.
If we're talking general data in our major hospitals in the valley, I mean, I don't understand the argument that it's identifiable when we're talking hundreds and hundreds of people.
Yeah, and that goes back to that communicable disease statute. So we would have to take a look to see what was potentially identifiable and what could be released.
Well, let me just clarify here. We would never prioritize a profit over patient. I would like to say a special thank you to all of our frontline workers, the doctors, the nurses, the emergency medical providers that have worked tirelessly through this, and we mourn every death. My heart goes out to all of these families, but it is not the hospital's fault. It's the virus that is doing this, and we'll continue working hard to keep our positivity low, and we will prioritize life over everything else, which is what we've done the entire time since the first case on January 27th.
We're going to get Telemundo in here, please.
I'm going to change the topic a little bit because I want to hear a little bit more regarding that test that you plan to develop with the microchip. If you can say a little bit more regarding that, how is that going to help the general public? I know you guys are still working on this, but when do you think this might be available for all Arizonans? How is that going to help? Also, if you could say something regarding just the cases in universities. We've seen a lot of them rising in all three, and Tempe zip code also has a lot of the highest positivity of COVID-19 spread around the state. So if you could just go a little bit.
Right, so first on the test. So the test is an advanced scientific tool shrunk down into a small plastic device called a microfluidic device. Microfluids, you spit into the device. The device splits your saliva such that it can actually get at the chemistry of the virus in the saliva itself. It then takes the DNA structure of the virus, splits that, moves the RNA from that, which is the heart of the creature, cooks that up in a small laboratory, and then from that chemistry that's revealed, you know whether or not you're positive. Now, the key is none of that. It's all in a little plastic thing. What we have to do is each time you build one of these, it has to be built for the virus specifically. We've built them for other viruses like the Zika virus. We were the developer of the test for the Zika virus. We worked with the military and others to develop these tests. And so the 6 months that we're going to take to build the prototype is to get this thing to work where I don't want to go through all the description of the science here, but where the RNA slots into a mechanism where you know where the chemistry is certain that you have this virus. And so that then, once we make that known, point of need means you spit into it when you need to. You get the test when you need to. You plug the cartridge into another device. That cartridge then communicates to your phone and you're ready to go. How do we think this will work? Well, initially it'll go to what the governor mentioned, frontline workers, et cetera, but we're also in the game from the tests that we already have, the PCR test, the saliva-based test that our team developed of mass testing. So we've already tested in the neighborhood of 100,000 individuals. We're deployed. So we're trying to do all these things with the department, Arizona Health Services Department at scale. So the hope is that this helps all Arizonans. Now, the most important thing is, but you have to believe this first, the virus will be here for a long time, and we're going to need testing for a long time. We're going to need tools for a long time. We're going to need health checks for a long time. And so 6 months is about as fast as we can do this, working day and night to get this done. And then eventually it'll be ubiquitously available, and it will be a powerful tool to make things happen in terms of you being able to move forward with your life.
I have a clear picture. Are we talking about like a small portable device that people will be carrying themselves?
No, there'll be a place to have the cartridge sort of talk to another thing easily somewhere. So the cartridge will be where you do the sample and the chemistry occurs in the cartridge. So if you have a thermometer that you've been checking your temperature with, it'll be about the size of the cartridge that your thermometer, your plastic thermometer comes in. To your second question, which is this issue of testing at the university, maybe that was your third question, but testing at the university, our positive tests are going down dramatically. That was your second question. Both staff is down, students are down, students in the residence halls are down. We're putting out our update later this evening when we look at our data. And then to the last question, which was related to the zip codes, the same thing is happening in the zip codes. And so we're studying the zip codes. We're doing epidemiological analysis of each zip code that we're present in. In fact, we're doing it of all zip codes. We're doing it for the entire state. So we produce epidemiological analysis every day, and our concern of about 3 or 4 weeks ago has now been reduced to now things are being managed. And so we're confident that things are moving in the right direction at the moment.
We're going to go to Dylan and then to Stephanie from the Republic. Dylan, go ahead.
Governor, so you said today that you would work with Speaker Bowers to get GPS and other agents across the entire state body cameras. I'm curious, are you going to call a special session to get that done, or is this open to anybody? Of course, because during the election, it's possible that Speaker Bowers won't be Speaker anymore. The Dems could end up taking control. So is this going to be open to anybody in the legislature, or will there be a special session?
I don't anticipate a special session at this time. Of course, I remain open-minded if there was something the state needed. One thing we know through COVID-19 is it's been unpredictable, and I'm grateful for the legislature's help along the way. But the body cameras are something that was in the State of the State on January 13th, 2020. It's something we have dollars for in the budget. It's really nothing more than the legislative act to get that done, and it will be a top priority in next year's agenda.
We'll go to Stephanie. We have time for one more. Stephanie from the Republic, please.
Yes, Governor, can you tell me about the $14 million, where the state is getting that money? And could you get a little more detail about how the $8 million is going to be spent?
Well, I'll defer to the university presidents. We've discussed different ideas with them around, like I said, testing, tracing, rapid results, the needs that we have on our university campuses. I don't know if you've seen what's going on in terms of Arizona's economy and what happened with our unemployment in this last month, but we went from 10.7 to 5.9%. It was a 44% decrease. It was a larger decrease than Texas or Florida or Colorado or Nevada or California or any other state in our region. So in terms of our state and a budget perspective, financial health, and the ability to bring jobs back. And I realize there are still people out there that are displaced and they are hurting. But we have tens of thousands returning to work. If you look for a metric, it's who can you compare and contrast what you're doing in comparison to other states. So we're in a position right now when we need an investment around COVID-19 for health and safety that these fine universities can deploy. We've had those dollars available, of course, working with the federal government as well, and the CARES Act dollars we've kept powder dry because we don't know what's going to happen going into the future, and we don't know what Congress is going to do. Well, I'll get you the details on that.
I think we have time for one more. Go ahead, Nicole.
Governor, you did say back on June 4th that you were learning, after some said that you suffered from white privilege. You said just now that you've had a dozen meetings following up on race relations. With who? Because many of those key leaders in the faith community who were at the table tell us that they have not heard from you. Is race relations a priority to you? And what are you doing to move forward here in Arizona?
Well, as I said, I'm listening. I'm learning. We've had a dozen meetings with members of the African American community, law enforcement, elected leaders. and we're talking about policy reforms that can happen. And yes, it is a priority.
Then why are we not seeing a special session moving forward to start to address some of the things happening right now?
This will be part of the legislative session next year.
And just one more question on mass. Scottsdale, they are about to have two big events coming up. They'll have Arizona Bike Week, Barrett-Jackson auction in October. The city rescinded their mask mandate. Are you okay with that? And do you think that maybe you need to start stepping in with a statewide mandate based on what these local jurisdictions are now doing?
I encourage people to wear masks. I think Arizonans have demonstrated a lot of common sense, and I think Arizonans are a common sense people. You can see since we put the mitigation efforts in place and local municipalities acted on it, our numbers have gone in the right direction for 10 consecutive weeks. I do think it's this personal responsibility, public education, and ownership of behavior, washing hands, socially distancing, staying home when sick, and wearing a mask. But I'm counting on Arizonans to make the right decision. I want to say in closing, I again want to thank these university presidents, Dr. Crow, Dr. Robbins, and Dr. Chang, for their good work and partnership and commitment against COVID-19. I'm also thrilled that our universities are open and operating, and our kids and young people and students are getting an education. A special thank you again to Dr. Kara Christ for the hard work that she's done the entire time, and to Major General Mick McGuire. One thing that was not touched on today was the opportunity for a vaccine. And this was something that really stole the show at our last video teleconference with the coronavirus task force. Although we do not have a vaccine at this time, the framework in terms of distribution and ideas around that are being formulated by all 50 governors, and it would take the resources of the United States military, the National Guard, of course, FEMA, along with DEMA to do this, private sector partners as well, and the universities would play a role in that. There's more to follow there. I touched on our excellent economic numbers in the state of Arizona. Our economy is open. It is coming back strong. So it's so important as we head into the fall and we head into flu season and things that remain unpredictable around the virus and COVID-19, that we continue the good behaviors and habits that we've acquired over the last 5 months. Let me close where I began by saying thank you to the people of Arizona for all their hard work around the pandemic. Thanks, everybody.